Viewers, today we will be talking about depolarization, repolarization, and hyperpolarization. You are quite familiar. These concepts are very important, especially in day-to-day activities, whether that is of the skeletal muscle or the smooth muscles, heart system, cardiovascular system, or any system, even the nervous system. So, what is important? It is important to understand that how an action potential is generated. You see, there can be different types of cells. Let's say there is a nerve. This is a typical nerve cell, and then it goes to the axonal terminalis, which contains, and here is the dendrites, you see, and this is classical nerve cells. This is node of Ranvier and internodes, and these are links. So once a stimulus or stimuli rather reaching here, so it excites the cells, the nerves. Here the neuron, the basic functional and structural unit of the central nervous system or the nervous system, is the neuron. Remember, the tissue may be a heart, you see, and heavily diagrammatic. It may be a heart, and it may be a skeletal, what you can say, a skeletal muscles, or what you can say, smooth muscles. So it is a muscle, or best terminology is the skeletal muscle. So stimuli may come here, reach here, stimulate the heart, and these stimuli may come here. So there are receptors on the surface of these cells, like in case of heart, these beta-1 receptors, and in case of skeletal muscles or the muscle, you see the muscarinic receptors. Here maybe receptor, maybe GABA receptors, you see, GABA receptors, or as the case may be. We are not so much interested here at this level. But what happens? Important is to understand that stimuli are different, or what you can say, sufficient amplitude comes here, and they are going to excite this particular nerve. When the nerve is at rest, so there is a potential difference between the outside and the inside of these cells. And let's say some positive nerve ion is inside, some negative is there. You see, negative is also outside. But in nutshell, in outside, the sodium cells are the sodium or the electrolyte is high outside, whereas inside the sodium level is less. Similarly, chloride level inside the cell is very high. Inside the cell, chloride level is very high, whereas outside it is less. These are basic things to understand. So thus, a potential difference exists. A potential difference exists between the exterior and the internal environment. You see, internal environment. So there is a potential difference between the external environment and the internal, and this gives you the concept of resting membrane potential, RMP. So important is that when stimuli of sufficient amplitude reach the particular cells, you see here, so it's going to stimulate these particular receptors present at the surface of these cells. So a cell may have excitatory receptor or may have inhibitory receptors. What is important? Important is to understand the concept of action potential. Action potential. So what is action potential? Action potential is generated when an action potential is generated when there are sufficient stimuli of enough amplitude to excite a particular nerve or a particular tissue. That here is the cardiac muscles, whatever the case is. This is purely diagrammatic, you see, cardiac muscles or the skeletal muscle, or as the case may be. Thus, when an action potential is generated when stimuli of sufficient amplitudes are there. And what are the stimuli? These stimuli may be wording, it may be an abusive language, it may be a very soft, polite language, terminology, it may be changes in the electrolyte system of the external environment or in the internal environment, or as the case may be. But at this level, it will tell you how an action potential is generated. So let me plot the action potential generation in a nerve cell. So we have reached the concept of resting membrane potential, RMP, and if the exterior, and there is a difference between the internal and the external environment, you see. This is purely diagrammatic. So what is important? The external side is positively charged, internal is negatively charged, but it does not mean that there is no positive charge inside, but in majority the positive charge outside is there. So recall your set of integer number is the 0, is minus 10, then the minus 30, or as the case may be, it is plus 10, plus 30, or 70, or as the case may be, here is the minus 70. So if I plot it for you, so remember, in case of action potential, since influx of current is there, and this influx of currents carries, the electrolyte is there, so it carries currents. If you recall your SSC secondary school level, once you were taught in the physics that V is equal to voltage is equal to IR, it means that voltage is directly proportional to the flow of current, where R is constant. Now, so it means that in case of a small, tiny, minute cells, this voltage is expressed as millivolt. So millivolt is dependent on the second variable, that is the time. So thus time is plotted on x-axis. This is x and x dash, and here is the origin O, and since the resting membrane potential is usually minus 70 millivolt, so voltage, or that is plotted on the y-axis. This is y, and the y dash, you see. Now let's see what happened. A stimuli of sufficient amplitude, let's say it goes in steps. It started here, reaching here. This is step 1, this is step 2, and at step 3 it's going to touch the threshold. And let's say this is the threshold. This is the threshold of this nerve. Okay. And before reaching the threshold, this is the RMP, resting membrane potential. So we give a set of stimuli 1, 2, and this is the 3. And once it's reached the threshold, so the nerve is fired. And once the nerve is fired, you see an action potential is generated. It reaches now, it has to come back to its original position, and this is called repolarization. Coming back to is again its resting membrane potential. Then again it is ready for the next action potential, like this one. Remember, what is important, it can go in single step as well. How it can go in single step? That there is energy of sufficient amplitude reaching here, and directly it can then stimulate, and an action potential is generated. So this is origin O, and this is origin O, and you see this is minus 70 millivolt, and it reaches, there an action potential is generated, and action potential is generated, action potential is generated, action potential is generated here. It has to repolarize again to reach the again resting membrane potential. So thus an action potential is generated, and this generation of action potential is now based on the influx of these electrolytes from the exterior into the interior of this particular nerve cells. Now if you are enough smart, you can manage this particular situation. You see, from here, this baseline till here, this is the amplitude. Let's say this is 10 millivolt. Let's say this is 10 millivolt energy threshold that we are going to give. If I increase this threshold here to this level, so the threshold new position will be here. Threshold new position will be here. Now stimuli of this much amplitude won't reach this particular threshold, thus the nerve is stabilized. Another way is there are GABA receptors. There are GABA receptors present, and once the GABA comes and attach with these, so it is coupled with the what you can say chloride channel. And if these are the chloride channels, so once the GABA come and attach with this, so the chloride channel opens, so the more chloride goes inside, and more chloride inside mean that this minus 70 millivolt goes more negative, so it goes somewhere else minus 90 millivolt. It means now the nerve is hyperpolarized. And in this particular case, now you have to start from here. So if the resting membrane potential reaches here, now this is a hyperpolarized nerve. So then, if you recall your memory, this current of this enough amplitude was of this 10 millivolt. So it will then start from here. It will reach here, but it won't reach neither this threshold nor the elevated threshold. So what is important? Important is that if you hyperpolarize the nerve, then a strong stimulus is required. Or if you alleviate the threshold, even then the current generated here won't be able to excite the particular nerve. Now this terminology is very important, especially in different clinical conditions. For example, this is brain, and in the brain this is dorsal view. Here is what you can say a tumor of 4 mm size, and the contrast images that confirms, you see that seems to be malignant, and what's the patient attendee is reporting that my patient, my son or my kid or the patient is having a problem like this, and upper limb is, if it is going to innervate the upper limb, so you see that there will be excessive neuronal discharges and the nerve innervating the upper limb will be stimulated. So what happens? There will be uncoordinated skeletal muscle contraction, especially in the upper limb, which has been innervated by that particular area, or the nerve that is nearby here. So what the physician or the health professional do, they prescribe benzodiazepines or the nerve stabilizing drugs. What benzodiazepine does, benzodiazepine goes and it attaches with GABA, potentiate the GABA, and then the chloride channel chloride goes much more inside. The nerve is now much more hyperpolarized. Then a strong stimulus is required to excite this particular nerve, thus the patient is stabilized. But if it is malignant, so after few months, like 6-7 months, you see the size of the tumor grows, and once the size of the tumor grows, so the current already generated here was, if that is of 10 millivolt, now that current goes increased to 20 millivolt. So the drug already prescribed, benzodiazepine, will work in the beginning, and it will lose working, meaning that the patient is not again managed. So the right history is important, especially in this particular case. Thus, and proper follow-up is important. So this is how the concept of elevation of threshold and the hyperpolarization and the depolarization is important in medicine and pharmacy, and of course dentistry or any other healthcare professional. So what is action potential? And action potential is a response that has been generated either in the nerve tissues or in the skeletal muscle or any living tissues, as a potential difference exists between the interior and the exterior. Between the interior and the exterior, a potential difference exists, and once a potential difference exists, it means flow of current is possible, and if flow of current is possible, it means it's simply working on this basic physics principle. So important is to understand the concept of depolarization, repolarization, and hyperpolarization. This applies to the heart as well. For example, there is a regarding heart model. These are the atria and then the ventricle. You see, this is purely diagrammatic. And what is important, this is the SA node, and then there is AV node, this is AV node, and from here then it goes the bundle of Hess and the Purkinje's fibers on either side, you see, and this is again purely diagrammatic. So what is important? Important is SA node. This is SA node, and this is the AV node. So there is beta 1 receptor present at the level of heart. You see beta 1 receptors, and there is norepinephrine is here. Once that comes and attached with that, what happens? Once these cells are depolarized, so ATP is converted into cyclic AMP. When it is the cyclic AMP that triggers the calcium inside. So what is important? Important is that depolarization of the atria start first. Depolarization of the atria start first. It goes inside, and the flow of current is reflected as a P wave in the electrocardiogram. P wave. Then once reaching this AV node, so it's a bit delayed, and what happens? Then there is a Q wave, and then the R wave, and the S wave, and then the T wave. So P, Q, R, S, and the T wave. These are the classical waves in an electrocardiogram. But this is very important, that this is the isoelectric line. If this isoelectric line, you see, uh, uh, is not properly maintained. So there may be either the ST segment elevation, it may goes up, there is ST segment elevation may be there, or Q wave depression may be there, or as the case may be. So what is important? Knowing the isoelectric isoelectric line or point is important. And different book says that if from the isoelectric line an elevation of 2 mm or more than 2 mm, then it's said to be significant. And that will be a separate story. So from the start of the P wave till the Q wave, this is called PQ interval, or in some books it is called as PR intervals, most precisely telling as PR interval. So, and then QRS, it is called as QRS complex. QRS complex. So, P wave is atrial depolarization waves. QRS complex is ventricular depolarization wave. It is ventricular depolarization wave. Ventricular depolarization wave. Depolarization wave, and T wave is ventricular repolarization wave. Repolarization wave. So now there are different intervals from the start of the Q waves. You see, from start of Q waves till end of T waves. You see, this is called QT interval. So these are very important. Why they are important? They are important as that P wave is atrial depolarization. So let me draw it for you for simplicity. It will be like this: the atrias are here, you see, and QRS complex is ventricular depolarization. So therefore, I will draw it for your understanding. For the student understanding is like this one. Thus what is important. Now, if SA node, from the SA node till the AB node. Now there are three characteristics of the heart muscles. The first is automaticity. The second one is rhythmicity. And the third one is conductivity. So any abnormality in conduction will lead to changes in the rhythm of the heart, beside certain other types of arrhythmias as well. So what is normal PR interval? Normal PR interval is that usually the PR interval is between the what you can say 0.1 second, say like as 0.1 second to 0.2 second, and this is important. Whereas the QRS complex, normal QRS complex in adult is 0.0 second, is still and where rare case is considered still 1 goes up to 1.0 seconds, but usually 0.08 seconds. And then the QT interval. So the QT interval, and the QT interval is 0.28 seconds on 0.44 seconds, but it is nowadays represented by a new terminology, and that is QTC, or corrected QT interval, which is out of the domain of this lecture. So what is important? Important for understanding is that if there is a decrease in the intraventricular conduction, so it will be manifested in ECG as widening of the QRS complex, meaning since this is ventricular depolarization, QRS complex refers to ventricular depolarization. So if there is decrease in the in the intraventricular conduction, so it will be manifested by the widening of the QRS complex. So the QRS complex goes and it is widened. Certain drugs that's going to slow down the repolarization phenomena is going to widen the QRS complex, or the drugs which decreases the AV conduction is indicated by prolonging in the PR interval. So prolonging the PR interval means that from the start of this SA node till this AV node, this is to mean that PR interval is prolonged. And drugs like beta blockers will prolong the PR interval. They prolong the PR interval. And corticosteroids, steroids will decrease the PR interval, and that is why they are used in the management of shocks. And antimalarial drugs will prolong the QT interval, antimalarials and quinolones. So this is a technical point to remember, and you will come across once you will be studying the electrocardiogram in detail. So in a nutshell, if the depolarization is slowed down, whether in the heart, so it will lead to abnormalities in the heart, rhythm of the heart, and of course arrhythmia. Or it is increased, and it will lead to tachyarrhythmia, and it can be a problem for you people. Thus, a normal electrocardiogram have a PR interval within the limits, and that is 0.1 seconds to 0.2 seconds, and what you can say, QRS complex is between this range, and if it is prolonged or widened, it means widening of the QRS complex. Certain drugs like moxifloxacin widen the QRS complex as well. So or the calcium channel blocker, verapamil, the influx of calcium is blocked inside the cell, you see. So it is blocked here, it mean the depolarization process will be slowed down, so the number of beats per minute will be decreased, and that is why verapamil and diltiazem, all the drugs, they are going to slow down the AV conduction as well as the depolarization phenomena. And probably they are antiarrhythmic, they are anti-angina, and of course they are vasodilators. So I hope you understand the concept of depolarization, repolarization, and hyperpolarization, and its importance in the medicine, and of course pharmacy and practice of medicine. Thank you.